If you have bipolar disorder, you will have severe mood swings. At times you'll feel very depressed, and other times very elated. It affects about 1 in 100 people and usually starts between the ages of 15 to 19. It rarely starts after the age of 40. When depressed or in a low mood, you feel unhappy all the time and may even think that your life's not worth living. You might find it hard to concentrate or to finish anything. You may lose your appetite and struggle to sleep. You may believe that you are uniquely guilty or worse than anybody else. When elated or in a manic mood, you have a strong sense of energy and optimism. You may believe strange things about yourself and even hear voices that other people can't hear. You may believe you're on an important mission or that you have special powers. There are different types of bipolar disorder. With bipolar 1, you'll have had at least one manic episode for more than 1 week. You might only have manic episodes, though most people have periods of depression too. Untreated, a manic episode will last around 3 to 6 months. Depressive episodes tend to last longer. With bipolar 2, you'll have had more than one episode of severe depression, but only mild manic episodes. If you, or those around you, suspect you're suffering from bipolar disorder, you need to see your GP. They may prescribe you medication to treat you during and between episodes. Psychological treatments can help teach you coping skills and ways to monitor and manage your mood. Find out as much as you can about your illness and what help there is. Try to balance your life. Getting too stressed or busy can bring on an episode of illness. You can't avoid all stress, so learn ways of handling it better. Learn to recognize the signs that your mood is swinging out of control so you can get help early. It's good to have at least one person you can rely on and confide in. Help them understand what happens to you and what they can do for you. Exercise can improve your mood. Give yourself time to relax and make sure you regularly do things you enjoy and that give your life meaning. Remember, many people have learned to manage their bipolar disorder and lead happy and fulfilling lives. Bipolar disorder.
So what causes bipolar disorder? Researchers think a key player is the brain's intricate wiring. Healthy brains maintain strong connections between neurons thanks to the brain's continuous efforts to prune itself and remove unused or faulty neural connections. This process is important because our neural pathways serve as a map for everything we do. Using functional magnetic resonance imaging, scientists have discovered that the brain's pruning ability is disrupted in people with bipolar disorder. That means their neurons go haywire and create a network that's impossible to navigate. With only confusing signals as a guide, people with bipolar disorder develop abnormal thoughts and behaviors. Also, psychotic symptoms like disorganized speech and behavior, delusional thoughts, paranoia, and hallucinations can emerge during extreme phases of bipolar disorder. This is attributed to the overabundance of a neurotransmitter called dopamine. But despite these insights, we can't pin bipolar disorder down to a single cause. In reality, it's a complex problem. For example, the brain's amygdala is involved in thinking, long-term memory, and emotional processing. In this brain region, factors as varied as genetics and social trauma may create abnormalities and trigger the symptoms of bipolar disorder. The condition tends to run in families, so we do know that genetics have a lot to do with it. But that doesn't mean there's a single bipolar gene. In fact, the likelihood of developing bipolar disorder is driven by the interactions between many genes, in a complicated recipe we're still trying to understand. The causes are complex, and consequently, diagnosing and living with bipolar disorder is a challenge. Despite this, the disorder is controllable. Certain medications like lithium can help manage risky thoughts and behaviors by stabilizing moods. These mood-stabilizing medications work by decreasing abnormal activity in the brain, thereby strengthening the viable neural connections. Other frequently used medications include antipsychotics, which alter the effects of dopamine, and electroconvulsive therapy, which works like a carefully controlled seizure in the brain, is sometimes used as an emergency treatment. Some bipolar patients reject treatment because because they're afraid it will dim their emotions and destroy their creativity. But modern psychiatry is actively trying to avoid that. Today, doctors work with patients on a case-by-case basis to administer a combination of treatments and therapies that allows them to live to their fullest possible potential. And beyond treatment, people with bipolar disorder can benefit from even simpler changes. Those include regular exercise, good sleep habits, and sobriety from drugs and alcohol, not to mention the acceptance and empathy of family and friends. Remember, bipolar disorder is a medical condition, not a person's fault or their whole identity. And it's something that can be controlled through a combination of medical treatments doing their work internally, friends and family fostering acceptance and understanding on the outside, and people with bipolar disorder empowering themselves to find balance in their lives.
So now what I'd like to do is I'd like to show you a clip from the movie